I'm sorry, I don't know if
Okay,
it's gonna.
so now we're talking about the second part of the cardiovascular system for step 2 CK. So if you are a 60-year-old, what's going on here? Sorry. If you are a 60-year-old male who just had an MI and I did a stent on you, okay? After that, you presented with a painless purple mottling of the skin on both feet. I measure your C3, I find it low. Your
Mm-hmm.
BUN is over creatinine is high, means signs of renal failure. Your analysis shows 10 white blood cells, 2 RBC by high power field. So what's
Mm-hmm.
causing your issue here?
Oh, hepatorenal syndrome or libido reticularis? What are we talking about?
So this condition, whenever you have stent thrombosis, because it's
Mm-hmm.
atherosclerosis in the thrombi. So when you do a stent, you're highly likelihood of displacing a clot or atherosclerotic clot and
Mm-hmm.
causing cholesterol emboli.
Mm-hmm.
The risk factor, so under cholesterol, how does that cholesterol emboli present? Present with livedo reticularis, dermatologic, or ulcers, or gangrene, or blue toe syndrome. Can cause
Mm-hmm.
renal failure. Can cause
Mm-hmm.
stroke, amaurosis fugax. It can cause ocular abnormality. They call it Hollenhurst plaques. It can cause
Mm-hmm.
GI, intestinal pancreatitis issue. Why? By just going. So this is just like a thrombi can go everywhere and can mess around everywhere. Okay,
Mm-hmm.
it's not like autoimmune that attacking only the joint. No, it attacks everywhere.
Okay.
The risk factors for it: cardiac catheterization or vascular procedure,
Mm-hmm.
and comorbid condition like type 2 diabetes, hypercholesterolemia, and hypertension.
Mm-hmm. Okay.
So, how do you diagnose it? You find elevated serum creatinine and eosinophilia and hypocomplementemia.
Mm-hmm.
That's it. On your analysis, you will find eosinophiluria. So there is a question about it. It's very important, even in step 3 in BME or some of the assessment questions. They present a case of cholesterol emboli and they tell you, what do you find? What labs?
Mm-hmm.
And then the answer was eosinophilia, something like that.
Oh, okay. Right.
So what is the gold standard to diagnose that?
The gold standard to diagnose it?
Uh,
Mm, I don't know, angiography of some sort?
you do
Not.
skin or renal biopsy, you will find biconvex,
Mhm.
needle-shaped cleft within occluded vessels, or you can
Mhm.
have perivesicular vascular inflammation with eosinophil.
Okay.
That's the description. Okay. Now, very nice question. If you are a 47-year-old Caucasian female with
Mhm.
nocturnal substernal chest pain that
Mhm.
wake you up during sleep,
Mhm.
EKG shows transient ST elevation in lead 1, AVL V4 V6 during the episode only. So how can I
Mhm.
treat you?
I'm sorry. Repeat that again.
So nocturnal chest pain
Mhm.
with ST elevation.
Yeah.
What is that?
Angina.
That's a special type of angina called Prince metal angina.
Uh huh.
Present at night and you
Okay.
treat it with diltiazem.
Right.
You never ever give a beta blocker
Mhm.
for this patient unless this patient your ex and you want to kill him.
Okay. Right.
So if you are a 64-year-old male who presents with
Mhm.
cramping pain on your right thigh after walking 2 blocks,
Hmm.
so what I do for you, what should I do for you? I do the ABPI, right?
Yeah.
I find the ABPI is zero point 0.7 on the right
Uh huh.
and zero point 0.9 on the left.
Okay.
So what if you're gonna die in the next 5 years? What are you gonna die from?
Peripheral vascular disease
Yeah, heart attack.
or peripheral arterial disease.
Yeah, heart attack, heart attack. Myocardial infarction. Okay, so if you are a 52-year-old male
Mm-hmm.
who's breathless on exertion, okay?
Mm-hmm.
When I do labs, I found the BNP is very high.
Okay.
What should I expect on heart auscultation?
S3
Wow, look at you. Good job. How do you know that? That's good.
because it's congestive heart failure.
Excellent, excellent, excellent. Yeah, that's a tricky question. Yeah, good job. Yeah. So this is the S3 is the most specific for heart
Mm-hmm.
failure. They present like this. Loop, tup, tup, 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 loop, tup, tup. Okay. Now this is very good case and a tough one at the same time. Very tough. So if you are a 58-year-old male who had a suicide, and when I check, like you had suicide attempt, when I check your
Mm-hmm.
blood pressure, I found it 76/40.
All
Pulse
right.
is 40. I examine you, I found bilateral wheezing.
Mm-hmm.
Okay, your extremity is cold and clammy.
Mm.
I do EKG, I found AV block.
Okay.
Okay, I gave you fluid, I gave you atropine, didn't work. So what's causing your problem?
TCAs.
I'll tell you about this. Is very tough one. This is so the this is the problems that beta blocker overdose.
Okay, you're gonna have to explain that to me.
Yeah, so
How?
beta blocker toxicity, it
Mm-hmm.
causes, beta blocker, it stops the heart from beating because the
Right.
heart beats, so it causes bradycardia.
Yeah.
So when you have bradycardia, the blood pressure will be low for sure. So that's why you'll
Mm-hmm.
have hypotension, bradycardia, and wheezing. That's what you know. Because
Mm.
you need to dilate your bronchi, you need beta receptor. So this
Right.
combination of bradycardia with wheezing, that's a
Mm-hmm.
beta blocker toxicity. That's what.
Okay.
Okay. So how do you manage that beta blocker toxicity?
Um, I don't remember. Glucagon or something. I don't remember exactly.
Yeah, good job. Yeah. First you give them IV fluid and atropine, and
Uh,
that if that doesn't work, then you give them a glucagon.
okay.
Good job. Then you remember. Good job. So if you are a 35-year-old female with shortness of breath and swelling and tenderness on the right cough. Okay, so I ordered ultrasound. I found a DVT, obviously.
Mm-hmm.
Okay, so I put you on heparin and I admitted you. On the sixth day of hospitalization, I found the platelet is 76.
Mm-hmm.
PTT is 63, 76,000, the
Mm-hmm.
platelet, and the PTT is 63 second.
Mm-hmm. Okay.
So what causing this issue for you?
Heparin-induced thrombocytopenia.
Yeah, this is unfractionated heparin.
Mm. So on the sixth day, it would show that. I thought it would be earlier.
That's a good question. So there
Mm-hmm.
are two types of hit.
Yep.
Okay, there's hit 1 and hit 2. What's the difference?
I don't know. They both show low platelet count. I don't know.
Timing. So hit 1 is in the first 2 days. It is basically
Okay.
like the platelet damages the heparin damages the platelet physically, like physical damage, non-immune. While
Mm-hmm.
type 2 is an immune.
Okay.
Like the heparin comes over and then the lymphocyte will be pissed from heparin in the blood, so it will make antigen to destroy heparin, but then by mistake destroy the platelet on the side. So this is hit 2. It takes like more than 5 days to develop this immune response. Okay.
Okay.
So timing. That's how you differentiate between both. Okay, so now it's a very good question. So if you are a 54-year-old male
Mm-hmm.
with a burning chest pain
Mm-hmm.
and you had a left-sided neck pain and feel sweaty and short of breath,
Mm-hmm.
and you are a smoker, you have a 30-year smoking history.
Mm-hmm.
So what? So now you presented with acute MI, okay? That's the
Mm.
presentation. So what should I expect on your auscultation?
You say he's a smoker and hypertensive or no?
Yeah. So if I want to summarize it, like in an MI, acute MI,
Uh-huh.
what heart sound do you find?
Ah, I'm not sure.
You see,
F,
the most common heart sound you could find S4.
F.
Yeah.
Hypertensive, right? Or-
Yeah, it can be in hypertension, but this S4 can be heard in acute phase of MI
Okay.
due to left ventricular stiffening and dysfunction
Hmm.
because of the
Okay.
ischemia. So this is like it's present like this. Tup 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 tup
Okay.
tup tup tup. Okay. So that's an easy question. If you have heart failure, what you order BNP. That's an
Yeah.
easy question. Okay, now this is a good question. If you are a 54-year-old male
Hmm.
with a tearing chest pain radiating to the back, that's it actually. Yeah, that's all what you need.
Aortic, dissectic aortic aneurysm.
Yeah, you see, without giving you that he has blood
Mm.
pressure difference on the right arm 90/60 and 70/40 on the left arm, and JVD
Mm.
distension, widened mediastina. You see, you didn't need any of those, and you found it. Good job, yeah. That's what make a good physician. Is finding it from minimum information. So, what are the causes? Okay, or the causes of serotonin syndrome,
Mm-hmm.
and how do you treat it, and how does that present?
So serotonin syndrome, like abrupt discontinuation of maybe SSRIs or what do you call it, interaction with something else. And he would present with something like NMS, but I think serotonin syndrome has the seizure part too, myoclonus something.
Yeah,
Correct.
how do you treat it?
Oh, I don't remember. Perhaps it didn't have some.
Yeah, good job. Then you remember, but that's just part of it. Like, so this is those are medications are very important. They ask about it all the time.
Mm-hmm.
Serotonin syndrome, drug interaction by
Mm-hmm.
SSRI, SNRI, MOA, TCA. Okay, that's the number one. Second thing, tramadol,
Mm-hmm.
linzolide, and
Mm-hmm.
ondansetron and sumatriptan.
Okay.
All of those cause SS. How does that?
Like their abrupt discontinuation or their interaction with something else.
No, interaction, not discontinuation. Like when you
Oh,
mix both together.
got it. Okay.
So how does that present? Hyperthermia, tachycardia, hypertension, diaphoresis, confusion, agitation, hyperreflexia,
Mm-hmm.
and the rigidity is not generalized. In NMS, it's very generalized, but certain symptoms is focal.
Mm-hmm.
Okay, clonus, increased bowel sounds, flushed skin, dilated pupil. That's all. So
Mm-hmm.
the treatment first, you discontinue medication.
Okay.
You give benzodiazepine to sedate them and for agitation and blood pressure elevation,
Mm-hmm.
and then you give them supportive care, oxygen, fluid.
Okay.
If that fail, then you give ciproheptadine.
Okay.
Yeah, and if you are worried about the airway, just intubate them. And it's
Okay.
ICS. Okay. So if you have heart failure symptoms, okay, so I don't need to tell you that there is crackle, distended JVD, swelling, okay, and you're taking medication which is beta blocker, AC inhibitor, spironolactone. Okay, those improve your survival, right?
Mm-hmm. Mm-hmm.
So, what medication, digoxin, does that improve survival in heart failure or not?
No.
Yeah, excellent. Yeah, those improve. So they like these questions sometimes, like AC inhibitor, herbs, beta blockers, spironolactone. Those
Mm.
four improve survival in heart failure. Okay, so now if you are a 53-year-old female with intra-arterial line is 70 to 40 over 40, blood pressure is 120. Now this is what I want you to pay attention for. So when the mixed venous oxygen saturation is 78
Mm-hmm.
and the pulmonary capillary wedge pressure is normal. So what type of shock is that?
Okay, repeat that. Pulmonary capillary wedge pressure is normal. Mixed venous oxygen is 78. And what were the other parameters?
That's it. But he's having shock picture like hypotension, tachycardia.
Yeah, but there was another thing you said, something 40. I didn't catch that.
The blood pressure is
Mm-hmm.
the blood pressure is 70 over 40.
Yeah.
Yeah, and heart rate 120. So he's
Mm-hmm.
shocked. Now I want you to know the cause of the shock from the PCWP and venous saturation.
Oh.
So if the PCWP is 6, what does that
Mm-hmm.
tell you? Is that cardiogenic shock or not?
No, I don't think
Yeah,
so.
no. So if it's a PCWP, the cardiogenic shock, PCWP would be decreased. Okay. So this is what tells you the clue. So the mixed venous oxygen saturation is increased.
Mm-hmm.
The only type of shock that caused that is septic shock.
Okay.
Okay, just keep it in mind. So if the right arterial pressure,
Mm-hmm.
so this is the difference. Like with hypovolemic shock, the PCWP will be low, but in cardiogenic shock, the PCWP will increase. Sorry, but the cardiac index will decrease. Sorry, I mixed the both. So in cardiogenic shock, remember PCWP increased, but the
Uh-huh.
cardiac index decreased.
What? Say that again? You're mixing.
So let me write it down. Do you see my screen, right?
Yeah, you were saying a couple of different things, so.
Yeah, cardiogenic shock. Yeah, those are a confusing topic. The PCWP
Mm-hmm.
increased
Okay.
and the cardiac index.
Decrease.
Cardiac index like cardiac output, that's what I mean.
Mm-hmm.
Okay, that's what it is.
And in hypovolemic shock, you said.
Both will decrease. Okay?
Right. Yeah. But in septic shock, PCWP you said would be normal,
Yeah.
but MVO2 would be low or high?
High.
Okay. What about this right atrial pressure? What is that about that you mentioned?
Right atrial pressure, what do you expect it to happen in cardiogenic shock?
In cardiogenic shock, it would be increased.
Yeah. How about volemic?
It would be decreased.
Good job. Yeah, that's it. You see, makes sense, right?
Yeah.
How about the systemic vascular resistance?
Systemic vascular, in which one?
And cardio and hypovolemic, what are gonna happen in each?
Hypovolemic, it'll be decreased.
No,
Cardio is going to be increased.
no, it's gonna increase in both.
Okay. Really?
Yeah, because systemic vascular resistance is that the RAS system, the aldosterone, okay,
Mm-hmm.
cause vasoconstriction and stuff.
So it'll be oh, but in septic shock it'll be decreased.
Yeah, and septic shock decrease. Yeah, you're right. Yeah. Yeah, and septic shock will be decreased. You're right.
Mhm.
Yeah. Yeah, those are confusing. Like it was giving. I used to hate that table, and
Mhm.
we tend to forget them. Like that. Like that's
Yeah.
what the human brain. Like it's crazy. Like these things. Like I studied them so hard and I spent so much time on them. But if you leave them, like they will just disappear.
Yeah.
Yeah, it's interesting. Yeah, but at least still, like when you go back to them, like you'll still have them.
Mm.
You know. Yeah, it's funny. There was one time my friend, like it's funny. He's telling me one doctor, like he said like he worked with him. He said like he's 80 years old or something like that, 7 years, and he said he's still reviewing step one material, still not. He said and he asked us about it, and if we don't answer right, we start yelling at us and stuff like that. It's funny. Okay, so now if you are a 65-year-old male would have difficulty walking uphill or climbing stairs due to the right thigh pain, and you must rest for the pain to stop.
Mhm.
And when I check your blood pressure is 180
Mhm.
on both arms. What's causing this hypertension?
Both arms 180 and you have to stop. I don't know. Peripheral arterial disease.
Can that cause hypertension?
Not sure. I don't remember anything that would do that.
Yeah, so there is a question they always ask about it, and it's very important, very high yield. So when they tell you there's diffuse atherosclerosis, like someone having intermittent claudication, or
Mhm.
diabetes, or hypercholesterolemia,
Mhm.
or mesenteric ischemia, or MI,
Mhm.
and then they present with hypertension, then this is renal artery stenosis.
Okay.
Period. Okay, so that's it. Like it's very important to know that.
Repeat that again.
Like when you have
Mhm.
intermittent claudication,
Yeah.
okay, so if there are plaques on your extremities and the arteries of your extremities, then most likely there is a plaques on your renal arteries.
Mm.
Especially if you have a hypertension, then that's most likely the cause until proven otherwise.
Okay.
Okay, so what are the secondary causes of hypertension?
Pheochromocytoma, renal artery stenosis, fibromuscular dysplasia. I don't know. List probably goes on, but that's all I can think of.
Can hyperparathyroidism cause hypertension?
Not sure.
It does, yeah.
Okay.
Hypothyroidism too, Cushing syndrome, PO. Those are the endocrine, okay?
Mm-hmm, mm-hmm.
And the primary aldosteronism too. That's endocrine too.
Did you say hypothyroidism or hyperthyroidism?
Hypothyroidism and hyperparathyroidism.
Okay.
Okay, so you get let's divide them into two. One, renal parenchymal disease and renal artery stenosis.
Mm-hmm.
The second one is that primary aldosteronism, PO, Cushing, hypothyroid, hyperparathyroid. The third one, coarctation of aorta.
Mm-hmm.
You will have differential pressure between brachial and femoral pulse. They have a brachiofemoral delay. Okay, that's it. Okay, so if you are a 32-year-old male with weakness and exertional dyspnea, okay, your right leg feel warm and flushed
Mm-hmm.
compared to the leg. Okay, 10 months ago you had a stab wound to your right thigh,
Mm-hmm.
and now you present with your right thigh is flushed and warm, and your left thigh is okay. So what do you
Mm-hmm.
think is causing? What do you think is going on?
AV fistula or something.
Excellent, yeah, and causes heart failure by increasing cardiac preload.
Mm-hmm.
Good job. So if you are a 65-year-old male who present with a 6 month history of periodic substernal pain
Mm-hmm.
that worsen with strong emotion
Mm-hmm.
and resolve spontaneously. When I performed myocardial perfusion imaging, it reveals uniform distribution of isotope at rest,
Mm-hmm.
but inhomogeneity of the distribution after dipridamole.
Mm-hmm.
So before dipridamole, it's homogeneous, but after dipridamole, you will have irregular distribution. Like, so what's causing that?
I'm sorry, you're gonna have to repeat that. So patient got dipyridamole, and then what happened?
So in the perfusion, so this is like a, it's a complex concept. I don't think they ask about it. It's like
Mm-hmm.
it's called coronary steal. That's what we call it. Do you remember something like that?
Coronary yes, something like that. But can you tell me in detail again?
Yeah. So this the idea of it. Like when you do perfusion imaging,
Mm-hmm.
you're not gonna find anything.
Mm-hmm.
But then when you add dipridamole, because it causes vasodilation,
Mm-hmm.
then will show the ischemic tissue. It's just like angina. It, you have chest pain with exercise. So
Mm-hmm.
dipridamole act like an exercise, dilate the vessels, because an
Mm-hmm.
exercise dilate automatically and worsen just to show the ischemia. That's the idea.
Mm-hmm.
Okay.
Okay.
Okay. So if you are a 64-year-old male with chest pain, pain worse by deep breathing.
Say that again. I was coughing. I didn't hear you.
Okay.
What?
If you have a chest pain worse by breathing,
Mm-hmm.
so I ordered your labs. I found creatinine to be 5. What's best next step here?
Creatinine is 5, and your I don't know. What is
Huh?
Wegmans or something? I don't know.
Yeah, so when you have renal failure and pericarditis, like chest pain worse by breathing, so
Uh-huh.
how do you treat that?
Well, first of all, what is it?
Mm?
What?
It's called, so when you have renal failure, you
Uh-huh.
have uremia.
Um.
Uremia is toxic to the heart, causes pericarditis.
Yeah.
Okay,
Okay.
so this is called uremic pericarditis. The management by dialysis.
Okay. Got it.
Okay, so what are the causes of pericarditis, by the way?
Um. Viral infection, or there's like something with MI after MI. Dressler syndrome. Um. Yeah.
Yeah, it could be trauma, it could be radiation, could be rheumatoid, could be SLE, Dressler. Then what BUN causes pericarditis? What level? More than 60. Okay, that's and malignancy can cause that too.
Mm-hmm.
Lung, breast cancer, and stuff like that. Okay, so diffuse ST elevation. What is that?
Uh, if you Pericarditis. There's some noise coming from your background. I don't know what it is.
Alright, no, there's no noise whatsoever.
See?
Huh?
There is some.
Really? No.
Yeah. That.
Huh?
That. All that. I.
Really? There's noise?
Yeah, I'm telling you.
Uh,
Okay, I already told you. You tell me. Is that right or add?
yeah, you're right. Yeah, this is. Yeah, that's right. So okay. So what are the Beck triad?
Muffled heart sounds, hypotension, JVD?
Yeah, so
Elevation.
excellent. Yeah, so if a 45-year-old male presents with those, what do you
Mhm.
expect on EKG?
Um, I don't know. Tamponade?
EKG shows electrical alternate
Okay.
because the heart swimming in the
Uh-huh.
blood.
Okay.
So sometimes goes this way, sometimes goes this way. Like it's like a balloon. Like okay, so if you have okay, this one is easy one. If you have a Brui, this is renal, abdominal Brui, renal artery stenosis.
Mhm.
I want to focus like on that. Okay, this one is very important. What are the reversible causes of asystole? There are 5H and 5T.
Yeah.
This is very important.
Can you go over them? Because I don't remember them. I just remember the five H's and the five T, that mnemonic, but.
Okay, 5H, hypovolemia, hypoxia,
Hmm.
hydrogen ion, acidosis, hyperkalemia, hypothermia. So all of these causes you can bring the patient back to life.
Hmm.
The 5T, tension, pneumothorax, tamponade, toxin, narcotic, benzodiazepine, thrombosis, pulmonary or coronary, and trauma.
Okay.
Okay, this you can bring people back to life too.
Hmm.
So if you are a 42-year-old male
Hmm.
who present with 2 weeks of weakness, low-grade fever, and exertional shortness of breath,
Hmm.
you have fingertip pain and urine is dark and cloudy.
Hmm.
Okay, proximal and distal phalanx are swollen.
Hmm.
What is that? What's
Tourette syndrome?
huh?
Tourette?
What is that? I'm sorry.
Tourette syndrome? Or arena phenomena? I don't know.
Raynaud. Let's think
Hmm.
about it. How's that can fit to Raynaud? Raynaud, they have fingertip pain. Will they? Do they have low
Wait,
grade fever?
go over the scenario again. They have fingertip pain or what else?
So 2 week of low grade fever.
Uh-huh.
Yeah, most likely infective endocarditis. That's how. Because
Yeah, just go over the little scenario you gave me though.
yeah, so 2 week of low grade fever,
Mm-hmm.
exertional shortness of breath, and fingertip pain.
Okay, got it.
Urine is cloudy,
Hmm.
dark and cloudy.
Hmm.
So what are the vascular and immunologic phenomena of infective endocarditis? You love that. That's important.
But why would the urine be dark and cloudy in infective endocarditis?
Yeah, now I'm gonna tell you. Yeah, that's a good
God,
question.
tell me. They have oscillars nodes. What is that thing in the eye? The rot spots and splinter hemorrhages, right? And a murmur. What else? Fever.
Yeah,
Mm,
because infective endocarditis is like cholesterol emboli. Like it's an up like infective endocarditis can cause abscess. Okay, so the abscess,
mhm,
some part of the abscess can flip and go to the system and
mhm.
goes to the kidneys and blocks the arterial supply.
Okay.
Okay, that's why it causes this dark urine and stuff. So it's cause systemic emboli.
Okay.
Can cause even splenic infarct. Can cause pulmonary infarct,
Mhm.
cerebral infarct, mycotic aneurysm.
Mm.
It can cause so Janeway lesion. Is that vascular or immunologic?
Janeway. Immunologic.
No, it's vascular. It causes macular erythematous non-tender
Uh-huh.
lesion on the palms and soles.
Okay.
How about if I tell you there is a painful villous nodule on
Mhm.
the fingertips and toes? What is that?
That's the
Osler, yeah.
Osler nodes thing.
That's immunologic or vascular?
Immunologic.
Immunologic. Okay. And there's Roth spots, which is edematous hemorrhagic lesion on retina.
Hmm.
That's immunologic too. Okay, so if you are a 68-year-old male
Mm-hmm.
who woke up one day and wanted to go jog and you lost consciousness because of your
Mm-hmm.
jogging, now you have a slow rising pulse.
Mm-hmm.
Carotid pulse is delayed.
Mm-hmm.
S2 is diminished. S4 is
Mm-hmm.
present. Yeah, that's it actually. You don't need any. What do you do next?
What do you do next? You do an echo.
Yeah, excellent. Yeah, this is echo. What diagnosis you thinking of?
Aortic stenosis.
Good job. Wow. You know you can even do cardiology fellowship. You
Thanks.
can. Yeah, delayed carotid. You, that's an aortic stenosis. Yeah. Do you like cardiology? Like,
Uh, I used to when I was in med school. I really liked it, but now it's more for the exams,
yeah,
really.
yeah, you're right. Can you become like a psychiatrist and a cardiologist at the same time?
Never heard of it.
Huh?
I mean, then it's a
No?
different fields. You can't. I don't
Yeah.
know.
Yeah, I met a girl, like, it was interesting. Like, she wanted medicine, so the only way she got combined medicine and psych.
Yeah.
But she wanted to do GI fellowship.
Ah.
Yeah, so it's gonna be too long, like 9 years resident, huh?
Mine is more like you stick to one thing, you do that one. I don't know. Everybody's different. They have different ideologies.
Yeah, yeah, yeah. I'm the same. Like, I just do one thing and that's it.
And to be honest with you, I don't really care.
Huh? What
I,
is it?
I don't care at this point. I'm just focused on step 3 right now.
Yeah, that's true. Yeah, yeah. So if you are a 68-year-old woman, okay, when I did catheterization, that was successful. After the catheterization on the third day, I found a bluish discoloration of the right great toe and all the toes on the left foot. Creatinine is 2.3. What's causing this issue?
Say that again.
You remember we did the first case that we did it was like this. When you had catheterization
Uh-huh,
and
uh-huh.
then you developed a bluish discoloration of the right great toe and creatinine
Right.
increased. What is that?
Levator reticularis, right?
Cholesterol emboli, yeah.
Oh, yeah, the cause. But is it called levator reticularis or no? Am I saying the wrong name?
No, I think this most likely due to emboli. That,
Is there a term to it or no? Like
no,
a
no,
oh,
just atheroemboli. That's
okay. Got it. Got it.
the video reticularis. They describe it like reticular, lacy skin discoloration with
Mm-hmm.
erythema that blanches on pressure.
Okay.
That's how
And that's not due to the cholesterol emboli, right?
it can happen with it, but
Oh,
they don't describe a bluish discoloration of the right grade toe and the toes of the left foot.
okay.
This is the if you want a fancy name for it, they call it blue toe syndrome.
Okay, well, that is fancy.
Yeah, cyanotic toes with intact pulses.
All right. Yeah, that's good.
Bluetooth syndrome.
Mm-hmm. Mm-hmm.
Bluetooth syndrome, not tooth. I'm joking. Okay, so if you are wow, they ask so much about the emboli, emboli. Okay, if you're a 64-year-old male who had a chest pain for the past 12 hours, I do EKG on you. Sad news, you have ST elevation, but your left leg is cold with mottled appearance, and there is
Okay.
minimal swelling and absence of distal pulses.
Mm-hmm.
So what should I do right now?
Absence of distal pulses and what else? Repeat it again. Sorry.
Yeah, no, that's okay. So if you have uh, MI
Yeah.
with absent pulses
Mm-hmm.
on your extremities,
Mm-hmm.
What should you do now?
Isn't that like a threatened limb situation or something?
Yeah.
So you amputate? I don't know.
Nah, the bears, yeah. First, you give them anticoagulation, vascular surgery, okay?
Okay.
And after that, you do transthoracic echo
Okay.
for left ventricular thrombus
Okay.
and just evaluate the left ventricular function,
Oh.
okay? So, if you are a 56-year-old male with worsening dyspnea and ankle edema,
Mm-hmm.
when I examined you, I found an increased JVP, bilateral ankle edema, tender hepatomegaly, bibasilar rails. Okay, echo shows normal left ventricular volume with symmetrical thickening of the left ventricular wall and
Mm-hmm.
slightly reduced systolic function, and you
Mm-hmm.
have erectile dysfunction too.
Mm-hmm.
So hepatomegaly, erectile dysfunction, heart failure.
Right. So that's that hemochromatosis, right?
Right, right. So now this is a good one, I think. So I want you to tell me if someone have hypovolemic shock, what's gonna happen to the cardiac output, PCWP, systemic vascular resistance, and blood pressure?
So in hypovolemic shock, they have no volume. Their cardiac index is going to be low. PCWP is going to be low as well, I think. And their SVR is going to be increased.
Yeah, good job. Yeah, that's SVR is the only one gonna increase.
What about the blood pressure?
Obviously, decrease hypovolemic. Yeah, yeah. Okay, now it's a very good case. I like it. Like 67-year-old guy, I present to you after a syncopal episode
Mm-hmm.
when you lost consciousness while shopping in the mall. EKG shows sinus rhythm with high voltage, a prolonged PR interval, prolonged QRS interval,
Mm-hmm.
and occasional premature ventricular contractions. Boom. So what's causing your syncope?
QRS interval is prolonged too, you're saying?
Yeah.
So Mobitz type 1.
Yeah, bradyarrhythmia. That's what it's. When you have prolonged QRS,
Uh-huh.
most likely bradyarrhythmia that can cause you to have syncope.
Okay.
So, so what rhythm disorder that can cause syncope? Or what are the causes of syncope in general?
Wait, hold on. So this bradyarrhythmia, it's not a heart block or anything? Just
Just a
normal thing?
yeah, just a bradyarrhythmia.
Okay. All right. All right. What's your next question?
So what are the causes of syncope?
Could be cardiogenic, neurogenic, vasovagal, orthostatic. Um, yeah, heart block.
So those are important. Okay, so I'm gonna discuss like a few ones. So
Mm-hmm.
s- I'm gonna ask you about the few ones, and the other ones I'll just give it to you. So if you have prodrome, nausea, warmth, diaphoresis, what is that?
Vasovagal?
Okay. What if you have cough, micturition, defecation, and then you had the syncope? What is that? That's
Hmm.
situational syncope.
Okay.
Okay. If you have blood pressure changes with standing, that's orthostatic hypotension.
Mm-hmm.
What if you have syncope with exertion or exercise? What is that? What's causing that?
Aortic stenosis.
Accent or hypertrophic cardiomyopathy or anomalous coronary arteries.
That's true.
By the way, anomalous coronary artery disease is a very tricky case.
Oh.
They present with a so this is how they present. Young guy who
Mm-hmm.
exercised and died. You
Mm-hmm.
did echo, you found it normal.
Mm-hmm.
That's a anomalous. So when you have exertion, sudden death with exertion, you think of HOCM immediately, right?
Right, right.
But if they tell you in the question stem the echo was normal, then this is anomalous, not how.
It's like exclude everything, kind of.
Yeah, yeah. How about if there is a prior coronary artery disease, prior
Mm-hmm.
MI, okay, and now he's having syncope. What's causing that?
How am I and now having syncope?
Yeah,
Hmm. I don't know.
this is most likely ventricular arrhythmia.
Ah.
How about if you have
Ah.
sinus poses on monitor, prolonged PR interval or QRS duration?
That's that bradyarrhythmia thing, right?
Yeah, yeah. Sick sinus syndrome can happen. AV block too. How
Right.
about if you
Okay.
have hypokalemia hypomagnesemia,
Mm-hmm.
and that causes a prolonged QT interval, and you have syncope? What's causing that?
Hypokalemia.
This is if it's hypokalemia or hypomagnesemia. This is called torsa de Pointe, which is acquired long QT syndrome.
Right, right.
How about if you have a family history of sudden death, and
Mm-hmm.
EKG shows prolonged QT interval?
Right.
Syncope triggered with exercise, swimming, sudden noise,
Mm.
or during sleep. What is that? What do we call that?
Hokum, right?
Oh, this is congenital long QT syndrome.
Oh wow. Okay.
Yeah, it's tricky. They, no, sometimes they just want to trick you like this, because it's very close. The answers are very close to each other,
Yeah.
and one thing that differentiates between. So, how to manage pulmonary hypertension due to diastolic dysfunction?
Due to diastolic dysfunction. Pulmonary hypertension?
Yeah.
Pulmonary
Hmm?
hypertension. Are we talking about congestive heart failure or just a secondary thing of pulmonary hypertension? What are you talking about?
Yeah, it's a CHF causing pulmonary hypertension. How do you manage that? Both, like how do
Well, if it's diastolic, then you give them,
Yeah, heart failure, like imagine like.
I don't remember. How would you treat it?
You give them AC inhibitor and the diuretics.
Okay.
Yeah, that's about it.
Which diuretic? Furosemide
Yeah,
or?
yeah, furosemide, yeah, Fosamax.
Okay.
So if you are a 53-year-old woman with systemic sclerosis, your blood pressure is 240, and you're having heartburn.
Mm-hmm.
I check your labs. I found hemoglobin is 6.9,
Mm-hmm.
platelet 57,000. So what's causing? What should I find on your peripheral blood smear?
I don't know.
So what's the diagnosis here?
No, I don't.
Yeah, it's systemic sclerosis.
Okay.
And can cause scleroderma. So scleroderma can cause microangiopathic hemolytic anemia with fragmented red blood cell
Okay.
schistocyte. So you find schistocyte on blood smear and thrombocytopenia. Okay.
Mm-hmm.
Scleroderma renal crisis present with renal failure, hypertension, and microangiopathic hemolytic anemia. Okay, how about if you are a 60-year-old woman on abdominal pressure shows persistent distension of the JV, like positive hepatojugular reflex.
Mm-hmm.
So this
Yeah.
positive hepatojugular reflex reflect what organ dysfunction?
Which, I don't know, she's having right heart failure.
Yeah, it's heart cardiac causes, not liver. Just so you don't be confused. It's very interesting. We had a patient like they just press on their liver and JVD increases.
Mm-hmm.
Like it's crazy. Imagine like the heart is failing. Wow, it's crazy. Like
Mm-hmm.
this human body is only made for some period of time. Like
Mm-hmm.
it must start deteriorating after. So if you are a 42-year-old man who just came here with fever, shortness of breath, and you have HIV, hepatitis C, you name it.
Mm-hmm.
Okay. So now you have palpitation on torso di pointe. How can I treat you?
First, electrolytes. You replete the electrolytes.
Give them magnesium sulfate.
Mm-hmm.
Yeah. So when do you give magnesium sulfate? What are the uses of magnesium sulfate?
Torsade de pointe, preeclampsia. Um,
Yeah, on preterm birth if it's less than 32 weeks. Okay, so if you are a 53-year-old male, on chest auscultation I found hollow systolic murmur at the cardiac apex and bibasilar crackles on the lung. EKG shows ST elevation in lead 1, 3, and AVF.
mm-hmm.
So what increased in this in your situation?
What will increase?
Yeah, what pressure?
Well, first of all, you're having an inferior wall MI and possibly mitral regurg. So I don't know what will increase.
The left ventricular filling pressure will increase.
Okay.
Yeah, because you know why, right? The
No.
the blood, the blood will back up
Mm-hmm.
because of the regurg,
Mm-hmm.
so they'll have increase in blood in the heart, in the left ventricle. Uh-huh. Okay, now 60. If you are a 68-year-old male
Mm-hmm.
who had a DVT atrial fibrillation, I gave you warfarin.
Mm-hmm.
Now your left extremity is pale, cool and pale,
Mm-hmm.
below the knee. Okay. Neither posterior tibial nor the dorsalis pedis pulse is palpable. So what should I do now?
Pepper? I don't know. What would you do? Is it a complication of warfarin?
No, like this can happen. So sometimes this. So complication of warfarin presents with skin necrosis. But this guy have decreased pulses to the lower extremities.
Okay.
Yeah, so it's acute limb ischemia. Yeah, so you're right. You just give them heparin. Yeah. If it decreased, then you give them heparin. If it's non-palpable and stuff, just be ready for angioplasty in case. Okay. Now this question: if you have inferior MI with hypotension, how can I treat you?
An excellent question. If you can go over that, that'd be great because that's my weak point.
Yeah. So if you have an inferior MI with hypotension, you give them IV fluid.
Mm-hmm.
Okay. First, you look at the heart rate. If the heart rate is fine, you give them IV fluid. If the heart rate is abnormal, then you give them atropine and then IV fluid. Yeah, that's about it. Okay.
Okay.
So if you are a 24-year-old male who have crescendo, decrescendo, systolic murmur in the left sternal border without carotid radiation, so what's causing your issue here?
Holcomb?
Yeah, smart, because at aortic stenosis at old age.
Mm-hmm. Right, the young guy.
Yeah. So if you are a 45 overweight smoker who have nocturnal chest pain that wake you up from sleep, EKG shows transient ST segment elevation on lead V4 and V6 during the pain attack. Yeah, what is that?
Repeat that again.
So if you have ST elevation at night and chest pain at night, what is that?
Uh-huh.
Yeah, what is that?
You said a lot more than that. Give me the whole thing again.
Yeah, nocturnal chest pain and ST elevation.
Yeah, so that's Prince Metal, right?
Right, yeah. And they asked similar to what? It's similar to Raynaud phenomena.
Oh.
When you have vasospasm of the stuff. Now, if your neighbor find a 65-year-old male that's developed sustained ventricular tachycardia and require cardioversion, okay, 3 months you gave him amiodarone. 3 months later, he complained of dyspnea. Chest X-ray shows bilateral lung fibrosis. What's causing that?
Amiodarone.
Excellent, excellent. Yep. So that's the we destroyed cardio. That's a good thing. It's the biggest. It's very huge. So now let's do just rapid review of whatever we discussed for today, so that we consolidate everything. Mm. Okay. So I'm just gonna do a rapid review. So okay. So okay. So if you have a renal failure and the Bluetooth, that's in cholesterol emboli. If you have a nighttime pain with ST elevation, that's a Prince metal angina. Um, if you have intermittent claudication, you gotta be careful. You can have an MI anytime soon. BNP with S3 associated with S3. If you have wheezing and bradycardia, that's a beta blocker overdose. You give them glucagon. If you have decreased platelet on the 6th day of hospitalization, most likely heparin hit 2. Okay, hypertension associated with S4. If you have chest pain, tearing that's radiating to the back, that's a dissection. The management of serotonin, first benzodiazepine and supportive. If it didn't work, then you give cyproheptadine. Digoxin doesn't prolong survival, but spironolactone, beta blocker, and the ERP does. Okay. Septic emboli, septic shock is the only one that have mixed venous oxygen saturation increased. Okay. If you have diffuse atherosclerosis hypertension, that's most likely renal stenosis. Okay. If your epic maximal impulse is displaced to the left, okay, so you have hyperdynamic circulation after a shot on your leg, that's most likely AV fistula. If you have chest pain worsen with the breathing and creatinine of 5 and B1 of 90, that's we gotta do dialysis for you. Diffuse ST elevation associated with pericarditis. Electrical alternate associated with tamponade. Okay. If you have distal interphalangeal joint are swollen with fingertip pain and low-grade fever for 2 weeks, that's most likely infective endocarditis. If you have delayed carotid pulse delayed, that's most likely aortic stenosis. Okay. If you have a mottled leg, then most likely left ventricular thrombus, so we gotta do echo to find out where the thrombus coming from. If you have erectile dysfunction with hepatomegaly, that's a hemochromatosis. Okay. If you have prolonged PR interval or QRS, that's most likely either sick sinus syndrome or bradyarrhythmia or AV block that can cause you to have syncope. Heart failure treated with diuretic AC inhibitor. If you have scleroderma, there's something called scleroderma renal disease. Can cause renal failure with hypertension and microangiopathic hemolytic anemia. Hepatojugular reflex indicate heart failure. Magnesium sulfate we give for torsadipone. Left ventricular pressure increased in inferior MI with holosystolic murmur due to papillary muscle displacement causing acute mitral rigor.
Mm.
Okay. If you have hypertension, give them normal saline dosage. If you have crescendo, the crescendo systolic murmur, and you're young, then this is HOCM. If you have pulmonary fibrosis after antiarrhythmic, then that's most likely amiodarone. Boom, and that's the end of the second part of cardiovascular, and there's one more part, and ouch, sorry, and we'll be done with the cardio. See, the paper injured my finger, damn.
Oh, goodness.
Okay, yeah. Okay, yeah, so this is the